Andrew, I wanted to come to you here from a leadership perspective, really. How and what role do leaders play in mitigating turnover? What is their actual role, and how can they foster a culture of retention within their organizations? What are some of the things that you are doing? What are the things that you are recommending?
Yeah, I mean, it's maintaining and growing your team of physicians is probably the most important thing, and executing on a strategy and supporting the communities that you serve. So I think it is the foremost important strategic and operational element that any healthcare leader has to grasp and deal with. I think there are macro and micro strategies. I think a macro strategy is, well, building a strategy. It's defining a plan. It's knowing where we're going as a health system, and then defining, over time, what specialties, what mix of physicians do you need to continue to operationally and strategically thrive in the communities you serve. So that has to be done, and that should involve physicians in that process. But on the micro level, it's approaching each physician, each specialty, each group, each market, I think, independently, and where the people are. An approach in hospital A may need to be very different than hospital B. So I think it's finding a balance of working within whatever system you're in, or organization, but at the same time, like I said, like understanding that doctor and finding time that works for them. I lived in Durango, Colorado for a while. I bought a mountain bike. That's what they do there. And so I think finding the time that's going to work for them, getting an authentic relationship, and then back to what I said earlier about responsiveness. When they have a question or a recommendation or a concern, being genuinely present, available, accessible, and then responding to it. If it's a bottomless pit of feedback, it's very dangerous. And I think that has to be a culture that can't be a one-person job. That has to be in the DNA of the organization to extend, that culture of physician retention. Always recruiting. No one's on the boat forever. So how do you keep them on the boat? How do you bring others on the boat? You just always have to be in that mode.
Yeah, it's a continuous process.